Okay, next we're going to look at the rotator cuff of the shoulder, and what we're going to do first of all is place the arm into 90 degrees of abduction and 90 degrees of elbow flexion. Yes, this is the sign of impingement, so one has to be careful when we're doing this movement. If I slowly externally rotate my patient, I'm trying to look for 90 degrees. And in theory, this is to test the length of the subscapularis. But again, if you are assessing a shoulder and there is a restriction, then it might well be that it's the joint capsule that is limiting the movement rather than the length of the subscapularis. When we are going this way, again 90 degrees, we slowly internally rotate, and you notice that the patient in this case will go to about 20 degrees, and ideally they should go to about 70 degrees. So in this case, it might well be that it's the infraspinatus, maybe the teres minor, that is partly responsible for this limited internal rotation. They actually call this movement, if it's restricted, GIRD, which means G-I-R-D, and those letters stand for glenohumeral internal rotation deficit or dysfunction. And we are blocked by that movement. Let's say, for instance, we externally rotate and we only get to about 45 degrees. Then it might well be the rotator cuff of the subscap is tight. If you watch the way I do this, my thumb and finger goes over the wrist here, and my hand, be careful around the medial epicondyle because of the ulnar nerve, lightly grip the humerus, and then I'm going to slowly traction to increase the space of the subacromium. And then from here, let's say there's bind. Take a small breath in, get the patient to turn their arm this way, so the patient is internally rotating the humerus using the subscapularis, and they push for about 10 seconds. After 10 seconds, relax please. Take a breath in. If you watch what I do now, as I breathe out, apply some more traction, and I do a wiggle technique. It's almost like a confusion technique because I want to increase external rotation, but rather than going into it, which might irritate, I will do almost like a cheating technique. So I flex and extend, and I increase the external rotation that way. Let's repeat please. Take a breath in, and on the out breath, slowly push against my thumb. Off you go. If your patient had pain pushing from here, you can bring the patient off the position, push again. If he had pain in the shoulder, you can take him off 90 degrees and take him maybe to 80 degrees. After 10 seconds, breathe in, and as I breathe out, traction, wiggle, and then once you get to 90 degrees, we don't really need to go any further unless we're trying to improve, say, the baseball pitcher. So that would be very well for the subscap. The infraspinatus, we can see that she is tight. Cradle the hand. So from this position, you can see a little bit of traction, rather than forcing the shoulder forward, which causes this rounding effect. If we go to the bind, my thumb again, take a breath in. When you breathe out, push it on this way. So my patient is externally rotating, using the infraspinatus and the teres minor and posterior deltoid. 10 seconds, relax, breathe in. And as I breathe out, traction and then a wiggle technique. So I'm trying to encourage internal rotation. You can see how I'm slowly increasing the movement without irritating the patient. Take a breath in. Slowly push again, please. I still maintain a little bit of traction as they push for 10 seconds. After the 10 seconds contraction, they relax. There's no rush. We have 25 seconds to improve. Breathe in. And as I breathe out, try and relax. Let it go, let it go, let it go. We are slowly encouraging the internal rotation as I wiggle into flexion and extension. If this is the third position, I'm going to just do this once more. Breathe in. Push again, please. So she's pushing for 10. I do like to sit. It puts my posture into a better position. Relax. Breathe. And on the out breath, off you go, off you go. So I'm going to try to get to 70 degrees, which I'm not far off. I would hold this position for about 25 seconds for the body to remember the new position. And then, so that's an MET for subscapularis and the infraspinatus.